Ambulance service, patient breathing.
We're back on the front line, following Scotland's paramedics.
Suspecting an opiate overdose.
For a gentleman said he's got a bomb. There's a RTC bus versus car.
What do you mean by his arm's gone? I need to get these details, OK?
Every day, they save lives.
There's the boot off, all right?
Just had a fit for quite a few minutes.
Hello?
Oh my God.
We need to be away from that.
But every day, they face new challenges.
When we go into people's homes, they are at their most vulnerable.
I just don't want to be here.
These things are hard to hear, and we hear them on a daily basis.
Just keep pushing, you're doing really well. We are given the instructions to help save their life. 1, 2, 3, 4.
Working remotely comes with challenges.
So if it's a day with the day.
Met some great patients, get some great stories.
That's okay.
It's a great job.
Slow, deep breaths, OK?
It's opened my eyes to life.
This is Scotland's ambulance service, serving more than 5 million people in every corner of the country. This time, we're with crews in Melrose, Aberdeen, and Newbridge.
There's a 3480 on scene at Locust. Storm, are you receiving? Over.
Lee and Phil are paramedics in the Special Operations Response Team, a specialist unit that deals with the most complex incidents.
Yes, receiving, go ahead.
Hi there, guys. Yeah, we've currently got an elderly patient who was last seen 3 days ago, has crawled into the space underneath the house. We've not been able to get much eyes on him. Seems to be unable to self-extricate. So that's the current situation at the moment.
Yes, that's all received. Is he making any verbal contact with you?
He's talking, but he could be a wee bit delirious. He's not had any water for 3 days. We're just trying to get bottled water down to him now to try and give him something to drink.
So it's just leaving base. We'll hopefully be with you in about 10 minutes, over.
Family have came round, seen 3 days worth of milk and mail and whatnot.
What an absolute sin. That we've probably got a wee elderly gentleman who's extremely scared, tired, dehydrated.
Probably not had meds for 3 days.
Yep. I think it'll just be all hands on deck, trying to get him out.
I've never, ever, ever in my full career heard of a job like this. And the whole way there, I'm thinking, is this real?
We don't know why they're down there in the first place. Have they had a heart attack? Have they had a stroke?
Here we are.
We just don't know. We don't know what's going on until we get there.
275 on scene.
A local paramedic is waiting to brief the team.
If he could get out, he would have got himself out at this point. It's been 3 days down there. We're trying to get some more space so we get some floorboard done and then take it from there. See how much more.
Maybe get debris gloves and all.
Fire service crew are removing carpets and floorboards immediately above the area where the man is trapped.
When we arrived, the scene was quite chaotic. There was lots and lots of people in a very, very tight space.
Just a sea of bodies kind of coming in and out and people standing at the door.
He was initially in a very small hole in the cupboard. He went down in,
So how's he been sorting the boiler then?
We don't know. There's tools out, the neighbours...
Oh, God, love them, eh?
But it might have been a few days ago.
What we're trying to do is find an escape route.
Aye.
We're not going to move him until you tell us that it's okay to do so, all right? You are in control here.
The fire service were called to this just because of the logistics of the job. We don't have tools to start removing floorboards. They've got special kind of cutters and grinders and all sorts of bits of equipment that we certainly don't have. So the fire service then work alongside us to enable us to get him out safely.
So we need to start some kind of treatment while he's under there.
Absolutely.
Get some fluids IV in him.
The fire service have removed a small section of floorboard above the trapped man. The patient, Neil, is conscious but confused.
You okay? We're not giving you anything right this second, but we're going to pop in some fluid.
The space that he was in was tiny. It wasn't even probably up to our knees, the depth of it. He was just covered in dust and dirt, and he looked really weak. He did.
I'm just going to put this in your arm, okay, Paul? Wee scratch.
Before the team can extricate Neil, they need to stabilize him with IV fluids and oxygen.
How are you feeling? You're okay.
I'm going to put a little mask on your face. It's just a little bit of oxygen.
We put him on oxygen as well because the fire service were using cutting gear. There's a lot of dust blowing about, so the oxygen mask would also protect his airway, because that would only just add to the complications that he already had.
Right. Extrication plan.
I think if we came back a bit further, it would be a bit easier.
I think we're going
What
to
are
be
you talking? The opening
being made a bit further down.
With Neil stabilized, the priority becomes getting him out safely.
We're going to have to cut the floor back that way and take him out straight up, because you're not going to get through there.
But the fact that Neil has been trapped horizontally for so long creates another medical issue.
We really want to try and avoid lifting him upright.
Toxins released from the muscles can enter the bloodstream and then be released into the rest of the body, which can then lead to a shock or cardiac arrest. We needed to get him out flat in order to not release any of these horrible toxins that's been lying in his body for 3 days.
Right, Ryan, Neil, cut him. Cut him now.
Ambulance service, is the patient breathing? OK, what's the address of the emergency?
At the ambulance control centre in Glasgow, call handler Declan is midway through his day shift.
Tell me exactly what's happened. No, listen, please don't apologise. We're here to help, OK? That's what I want to do. So, did you take these tablets with the intention of harming yourself?
The caller tells Declan that they have taken an overdose of painkillers.
No, don't hang up. Stay on the phone with me. Let me help you, OK? My name's Declan and I want to help you, OK? So I need you to stay on the phone with me. All right? Right, I'm not going to do anything that you're not comfortable with, but let's get through the call together and see if we can get something sorted for you, because you're needing some help. As soon as somebody comes on the phone, if they're in the midst of a suicide attempt, my first priority is to get them to just stop whatever the attempt is so that we can get an ambulance to help. You're still taking them tablets while you're on the phone to me? Right, OK, so is there any way that you can put them away for me? I need you to keep yourself safe, so can you put the tablets away for me? During the call, the patient was continually making attempts to try and end their life. And as much as I tried to talk them down and get them to listen to me, they weren't engaging with that part. Are you going to do that? Just stay on the phone with me and go and just flush the tablets away. It means that you don't have the urge to take them because you'll have nothing to take.
Declan has had an ambulance dispatched to the caller's address.
You've reached out for help, so I need you to work with me. We've got to do it together. You can't do it alone, and neither can I. We need to do it together, OK? Don't hang up. Stay on the phone with me. Let me help you.
The caller tells Declan that they have previously had a negative experience with the ambulance service and are reluctant to accept help.
Okay, so I'm sorry that has been your experience, but I'm going to try and change that today. Okay? I'm here to listen to you, so if there's anything that you need to talk about, you can go ahead and I'll listen. You know, but you do want help, that's why you've dialed 999. You've phoned us for a reason, okay? So I'm going to get someone out to help you. But to do that, I need you to keep yourself safe. You need to be able to care for a caller. If you don't show that you care, that's when it becomes robotic and it's difficult to make a connection with them. They need to feel supported and they need to feel that they're being listened to, because at that point, they'll feel that their world's falling apart. So it's up to us to try and piece wee bits back together until we can get the help to them. And I know you might feel that you've got no reason to live, so we need to get you help so that we can find you that reason that makes you want to keep going on. Because everyone has one, it's just sometimes the lines get blurred and it's hard to find it. Calls regarding mental health are extremely common. I've never had a shift in the service where I've not taken a mental health related call. On a human level, it's emotional when you get calls like that. I've had my own struggles with mental health in the past. I really try my best to connect with people that are phoning in regarding mental health, because I know how it feels to be at rock bottom or to feel that nobody's listening and that nobody understands. So I've got the help all arranged for you. We will be responding as quickly as we can. Shouldn't be too long, okay? In the meantime, I want you to do your best to keep yourself safe. If you do get worse in any way, just pick up your phone and phone us back, okay? All right, we will be with you as quickly as we can. I've got the help all sorted, and I hope this time it's a better experience, okay? Right, take care of yourself now.
You can't take that joist out. You can't take that middle.
We've got to be careful about what we remove.
Absolutely.
Yeah, I know,
yeah.
aye.
Back in Edinburgh, the Sort East team are working with the fire service to free Neil, an 85-year-old man who's been trapped under his floorboards for 3 days without food or water.
We need that space bigger though. We are going to struggle.
More flooring is being removed to create space for Neil to be lifted out horizontally.
At the end of the day, the floor's irrelevant. So let's just take all that away. That gives you all the space you need, and we might be able to manoeuvre in some way to get him out of that gap.
If you move that person a certain way, you sit them upright or whatever, it releases toxins and it can basically shut down all their organs. So given how frail he already is, we're best trying to keep him as flat as we can. And that's why we've put in IV fluids as well, just to try and help his system.
Time now.
Neil, you okay?
Let's move this out of the road. We'll kind of manoeuvre him a wee bit better.
So we're going to move your legs over first.
I think he needs to go down maybe another inch or two.
I can pull this board down a bit.
Aye.
But he'll come down.
Aye.
The team will use a scoop stretcher to secure Neil in a way that will minimize the amount of movement and avoid causing further injury.
Right, the stretcher's just coming up down to your right-hand side now, Neil, okay? Alright. It's just coming up, and they're just trying to connect it round you.
Looking at the size of the space that he was in, we quickly realised that the scoop stretcher was going to be the best option and probably the safest option. It's the other stretchers that we have, we would have had to move him a little bit, and that's what we didn't want. So we kept him lying totally flat, and the scoop stretcher went on either side of him.
Hello.
Patients on the board and they're probably going to be coming out soon.
Oh, Paul. Yeah, I've got the pillow here. We're just clipping you in first.
That's
Yes,
it. That's
right.
We're needing somebody.
We'll get that pillow back under your head.
Yeah.
With the scoop stretcher in place, it's time to try and lift Neil.
Phil, are you all right?
Yeah.
Right, okay.
Right, heading towards the front door.
Cheers, sir.
Going. Cable. I'm up.
Just so the tissue or that.
there, don't move.
We don't want to lose the rest.
Aye.
We'll keep it flat. Right, I need to pass that down. Got it? Okay.
There still.
I'll update control and now we're out.
Well done, guys. Fabulous.
Well done, team.
The lift has been a success, but now Neil needs to be properly assessed. But as they examine Neil, his condition deteriorates.
Okay.
His colour's changed a little bit, his pulse dropped, and there was a real thought that he might go into cardiac arrest.
You all right? Is he going to go? Eh?
Look at you. You're a bit yellow. Shall we try maybe up to him at 19 litres?
Look, I could try his legs as well.
Yeah,
I'll just try anywhere.
Just as long as we get some access, get some fluid and stuff.
Straight up.
I'm going to put this wee thing on your nose. Neil, just relax this arm.
Why are you taking me to hospital?
You got very low oxygen levels. Are you saying do you want to stay here rather than go to the hospital? No. You're going down.
You stay away first,
so
buddy.
we're
All right.
saturating now at 70% on 19 litres. So,
Right, he's quite happy. Thankfully, his numbers started improving, his obs started improving a bit, so yeah. He didn't deteriorate as we kind of first feared he was going to.
With the patient stabilised, the local ambulance crew will now take him to the Edinburgh Royal Infirmary to receive vital medical care.
It was actually a bit surreal, certainly not a job that you go to every day. Nobody expects to find an 85-year-old gentleman under the floorboards of a house, and especially such a tight space. It wasn't even as if there was room to crawl about. I don't know how he's managed it, to be honest. He's certainly not out of the woods by any manner of means, given his age, given that he did look quite frail. We just hope that it has a good outcome.
For today, we have a yellow warning of heavy rain from the Met Office across Western Scotland. That rain will just keep coming, persistent and heavy, leading to poor road conditions with lots of surface water and spray and a risk of flooding.
I love Scotland. I don't want to be accused of bashing Scotland as an English person, but it wouldn't be so green without the amount of rain. Let's put it that way.
As the remnants of Hurricane Ernesto batter the west of Scotland, West Sort team leader Daniel and paramedic John are dealing with multiple reports of road traffic incidents.
Yeah, Roger, disregard the trailer incident. There's a job coming down, RTC, Clydebank, Tallgreen 45, duplicate calls, one advising patient is trapped, one advising they're not. I'm listening in, we'll allocate resources appropriately once we know what's going on with these two RTCs. Weather plays a massive part in any job we get, be it RTCs, the increased number of them in the rain. Assessing the weather for the day is something we do on our safety huddle every morning at 8:30, because it does have a direct impact on the type of jobs we go to and the severity of them.
It's 9 p.m. Daniel and John are en route to their third RTC of the day.
So this is a one-car RTC, car into a tree, 4 occupants, 2 kids in the back, drivers complaining of neck pain and front passenger laceration to leg. I've not been advised how severe.
The crash has occurred on a country road just outside Lanark.
By the sounds of it, I'd imagine it's a front impact into the tree, being that they're the ones, the driver and the front passenger appear to be injured.
The collision sounds serious, and the crew are 40 miles away from the scene.
A tree is not designed to transfer the force of a car hitting it the same way another car is. Two cars coming together will generally absorb the force. So whether they turn, they spin, that force is exerted away from where the people are sitting. That tree does not move, so that force goes straight into where the people are sitting. So they can be really quite significant events.
The fact that two children have also been involved in the crash is a big concern.
Always with kids, the emotions are heightened. There's always a little bit more adrenaline. But also, children can't be considered as just small adults. The way they're treated or the way they're assessed is completely different just due to the changes in their anatomy and their physiology from adults. So it's a completely different way of working and a completely different process of preparing for those jobs.
Not far now.
Despite the horrendous weather, Daniel and John have made it to the scene in 40 minutes.
Come on, that bend, didn't it?
Yeah. Those tyre marks. Yeah. Cool.
Hiya, how you doing?
Do you know the circumstance?
Yeah, pretty much just the...
One car RT3, car V3, two adults have been out the car when we've got here. Then we've got the two kids out. Two kids are currently in the back of our car.
On arrival, the vehicle was down a slight sort of ditch off of the road into a tree. The car had hit the tree head on. The front of the vehicle where the engine bay had taken the majority of the impact and the force through that. So the car was damaged, but the passenger cell was intact.
While a local ambulance crew treat the mum, who has an injured leg,
Magic, thank you very much. All right.
Daniel and John turn their attention to the dad and two children, aged 1 and 3, who are sheltering from the rain in a police car.
Dad's in here, isn't he?
Yeah, Dad's in here now. I think the kids need looked at. The oldest one was kind of screaming when we got here. Youngest one, I'm not going to lie, mate, when I first looked, didn't really see him moving and that. I got a bit of a fright, but he's all right. He woke up, had a wee bit of a yelp, and then went back to sleep. So.
Oh, mate. Dylan, how you doing, mate? I'm John.
Hiya, pal. Hello. How you doing? The driver, the dad of the family, was up and about, tending to the kids who were in the back of the police vehicle. So he was clearly very mobile, didn't appear to have any injuries or aches and pains or concerns on that front. The little ones were in no way upset, no way showing any pain. So my initial feeling was maybe keep an eye on the little ones for the time we were there, just to ensure that nothing has changed in the gap from First Division Resource having assessment of the children.
How's the beans? How have they been?
He seems to be fine. He's going on as if it's never happened, but apart from that, he's fine.
While both children appear to be unharmed, the crew focused their attention on the 1-year-old boy.
I take it he was awake after, just falling asleep now?
He was, but he started laughing.
Okay.
I just blanked out what to be on.
So it wasn't upset in any way, wasn't
he?
He was. Okay.
It was great on me, but not much.
Quite late for him as well, I take it. It's probably...
But KFC, the one we settled on.
All right, so a bit of milk and he's settled. Always with kids, you have to find a expected normality for them and work within that, because they're very sneaky. They don't show you what's wrong with them in the standard ways that an adult would by checking their pulse or their blood pressure or their neurological response. So you have to be a little bit more fluid in it. Sorry, mate. I'll wake you up. Hello. Did you think it was the phone for you? Some milk, little man. Have some of that. Oh, yes. That good?
After monitoring the children, Daniel and John are confident they require no further treatment.
Once we'd assessed that now he was awake, normal social cues, nothing to suggest he was injured in any way, was looking around the car to see what was going on, so no concern for neck pain, etc.
Right, boys. Good man. Seen a couple of right?
To give them an extended period of monitoring gives everyone the reassurance that when you discharge them into the care of the family, you've really covered all the other potential risks.
Oh, thank you very much.
Thank you.
These roads are dangerous, by the way.
Absolutely, yeah.
Right, no, that's brilliant. Thank you.
With the team satisfied that the children have not sustained any injuries, they will now be dropped off at their gran's, while their dad accompanies their mum to the hospital.
Perfect, no problem, thank you. Thank you very much.
See you later, mate. Take care.
After a very wet and busy night, the team can now head back to base.
I think it could have been all of us. Excellent.
Certainly doesn't seem to be anyone injured. The kids are fine.
Yeah.
There was no major traumatic injuries to anyone involved in all of the jobs we went to. As bad as the weather was that night, every single RTC had as good an outcome as you could hope for, really.
I think I'll get my shades on.
Rock and roll.
It's a sunny morning in Melrose, and paramedic crew Laura and Mel are beginning their shift.
Mel's a hoot. You know, you're funny on the way to jobs. You know, our downtime is just really good. We have such a laugh, which I think is needed in this job. You know, you need that bit of humour just to get you by.
Definitely. And I quite like Laura's wisdom.
My wisdom? Oh,
very wise. Yeah.
The pair have been working together for almost a year and have already formed a close bond.
That makes it though. Like, you know, the fact that we get on and we're friends and, you know, we trust each other. We've got each other's backs at jobs, and that makes a massive difference.
Yeah.
Yeah,
we seem to know what each other's thinking, don't we?
Yeah.
We don't even need words. I can look at Laura and she can look at me, and we know exactly what we're thinking or what we need to do.
Exactly, yeah.
Oh, yeah.
There's a Greg here.
Oh, can you not tempt a wee sausage roll?
No, I'm fine. No,
I'll get you.
I'll have a coffee if you're getting coffee.
Just as Laura and Mel finalise their coffee order, a call comes in.
We've got a 93-year-old male.
Caller's son not living in area, patient alone.
The caller's concerned about his father, who is experiencing breathing difficulties, but further details are scarce.
Such an array of conditions that can cause difficulty in breathing. We've not got a lot to go on, do we really? So we'll just have to see what we get when we get there.
Mel joined the service 3 years ago after previously working as a healthcare assistant.
I sort of played with the idea of joining the service, but I think for me it was confidence. I didn't think I'd be able to do it. When I started recruiting again, I thought I'm going to have to just try and see if I can do it. Because I didn't want to regret. Kind of like, no, trying.
Yeah, exactly. And look at you, you've done it.
I've done it. I can't believe
excelling.
I can't believe I've done it. I've learned so much from Laura.
Oh, that's nice.
I have. And I'm so lucky that I've come to a station that's very close and have each other's back. It's good.
Yeah, definitely.
Straight on.
Okay, let's go and see what's happening with David. So we'll grab the old shoe as well. Hello.
Hello.
Hi, David.
Nice to meet you.
So, David, I'm Laura. This is Mel. All right.
Laura.
So, tell me what's been happening this morning, David.
Well, I haven't been so well. I'm a bit kind of confused. I know where I am, and I know where to,
Yeah.
I know what my name is and all that, but I'm not 100%.
Okay. Sometimes it's difficult if they're on their own and we don't have any family members or carers to ascertain whether they're normally confused, if that's their baseline, or if this is acute and new today. So we have to really just go off of what we see.
Yeah, at that specific time.
Have you ever felt like this before?
Not to such an extent as this.
And do you live with your wife, did you say?
My wife's in hospital.
Oh, no, okay.
Yeah.
Okay. Has she been in a while?
No, she's only been in a couple of days.
Right, okay.
Would you mind if I done some checks on you, David? Just got to pop this on your finger just to check your O2 levels.
So would I be right in saying that you're maybe under a little bit of stress now that your wife's in hospital? Are you?
I am that way as well.
Yeah,
Sure.
you'll be missing her as well.
Yeah. And that's mainly what the problem is, I think.
When the patient is presenting as quite anxious, your approach is so important, and you have to just get yourself down to their level and just try and reassure them. Let's see what your numbers are like. So your oxygen is perfect, okay, and your breathing is normal.
So it's not too bad.
Your blood pressure is on the higher side, all right? I feel like you've gotten yourself in a bit of a tiz this morning.
I did just.
Listen, that's why we're here.
Yeah.
That's why we're here. Okay, we'll get you sorted. A lot of the time, the elderly patients, they don't want to cause a
They don't want to
bother, do
cause
they?
a fuss, but I think it's that generation.
100%.
They're strong.
Although David's obs are mostly normal, his temperature is high and Laura thinks she's spotted the cause.
Can I just have a little look at your legs? Okay, fine. So you've got a little bit of an infection.
Have I?
Possibly. You've got a temperature, certainly. 38.2. His lower legs were red, they were quite fiery, quite hot to touch. He could be developing cellulitis, which is an infection in those lower legs. So that definitely needs to be looked at. And that could, in itself, cause new confusion. So that could all link in.
So we'll take him to the Borders A&E department.
So
we'll get him triaged in, get him booked in, and one of the doctors will come along.
Okay.
With the possibility of an infection, the paramedics need to get David to the hospital as soon as they can to prevent any further complications.
David, would you mind taking off your jumper? Right, I'm just going to lift up your T-shirt. I'm going to be gentle, pulling these stickers off.
Just heave away.
You're getting a free wax. If you can't communicate with your patient and actually build that rapport, you're not going to get anywhere at all. Just make them feel at ease. Ken, they're going through a really difficult time. They're not feeling their best. So it's your job to step in and reassure them and just try and make them as comfortable as possible when they're in your care.
So we're going to strap you right in, David.
Okay.
Okay, a couple of straps over your shoulder.
Yeah.
And around the side. You'll feel like you're going on a parachute jump.
Good, I don't want to be on that, but
But we can
I'll take
pretend.
your word for it. That's my phone.
Have you got it on you?
Yes, it's yeah.
Have you got it?
Could you check if there's an incoming call here?
Say Laura, the paramedic who's been seen to your dad. He's all right, yeah. I think it's hugely important to keep the family members, in the loop. It's reassurance for the son who can then, tell the family, don't panic kind of thing. So did he phone you this morning? I tell you, he doesn't look 93. He's doing brilliant.
I feel it sometimes.
He says he feels it sometimes. Do you want to speak to him?
Hi there. Yeah, I'm not too bad actually. I feel not too bad. Thanks for everything you've done. Could have been. Thanks. I love you much. Cheers, man.
That's us here, David. So I'm going to go in and book you in. All right, get us a room.
Thank you very much.
Hopefully not too long a wait. Okay.
Well, thank you very much. You've done. I'm very happy with the service.
You're not rid of me yet. We've got your room.
There's room at the end.
There is.
We've got to get you in.
Sit. You all right?
Going down.
Yes, fine.
The team check David into the Borders General Hospital. where clinicians can hopefully get to the bottom of his condition.
There's definitely an element of like anxiety there as well, and stress.
100%.
What a shame with his wife. She's been in 3 months, and he said 3 weeks, I'm sure, didn't he? So
He'll be up to 90. We had no being there.
stress.
Been married for a long time.
I know.
We'll be lost.
We'll just be keeping each
Like
other
you,
going.
you'd be lost without me.
I would. I'd be very lost without you. Yeah. You keep me right.
You keep me right.
Right, is everybody ready?
Yeah.
In Aberdeen, ambulance crew Wendy and Dawn are joined on shift by student paramedic Amy.
So I knew that I wanted to go into healthcare in some aspect, but I wasn't sure what area I wanted to go into. I went to college and did an HNC in healthcare practice, and while I was doing that, I understood that I wasn't made to work in wards. So I started to pursue the paramedic pathway and went to uni at Robert Gordon to do paramedic practice. It's so much fun. I can't even describe like all the jobs you go to, all the stations you work in. People are so welcoming. You get to see everything. It's definitely ended up being the career that I want to go into, and I'm so happy that I've ended up coming the way that I have.
The crew have been tasked to an elderly woman who is called NHS 24 after taking a large quantity of sleeping tablets.
Some people, they've made the call. They don't really want to end their life. But they've maybe got no choice and they feel that it's all they've got, then they do it, and maybe regret comes in.
As part of her training, Amy will take the lead when they get to the patient.
A lot of the time, our job is basically just problem solving because nothing is ever as straightforward as you think it's going to be. Being able to keep a level head, and as much as on the inside you'll definitely be thinking, I don't know what I'm doing. On the outside, you just need to show that you do. Just having some confidence in yourself.
Hello, I'm Amy and this is Wendy.
Hello.
And you've got Dawn as well. So, Angela, am I right to understand that today you've taken some pills?
The patient, Angela, reveals that she was first prescribed sleeping tablets 25 years ago.
They were chucking them out like confetti, I mean, and then they took away the prescription altogether. Now, the thing is, you don't have to be silly to find out where to buy them.
Yes. So, did you buy them online?
So, I buy them online.
Okay. Where is the tablets just now? And I'll have a wee nosy at them. Are they in this envelope? So, when did you start taking these?
We don't actually know what was in the tablets. She'd bought them online. It wasn't properly labelled boxes. They could have been anything.
I haven't taken any more than the 7 I took this morning. I'm still quite depressed. I haven't got out of my bed or got undressed every day.
Okay, so your depression, did it come on after this started?
No, I did get depressed sometimes.
Before?
But this is just making things worse.
No, absolutely, absolutely.
So when we go into people's homes, they are at their most vulnerable, and sometimes that can be quite challenging. But if you speak to the person like they are an individual, if you can empathise with them, eventually, hopefully, they will start to open up.
What would you ideally like for us to do here, Angela?
I don't know, just leave me and hopefully I'll feel better tomorrow morning.
So, just because you're taking a pill that is not prescribed to you, we don't really know where it's coming from, and you've had quite a lot of it today, I think it'd be very worthwhile having a little trip up to the hospital.
I went there because I was feeling bad at one point.
Yeah.
At a couple of points. And I just went into the emergency, whatever. I sat in the ambulance for 4 hours. I then waited in the emergency for for another 8 hours.
I totally understand your feelings about the trip to hospital, OK? But I would really, really like to try to help you get some support in place.
You know, they're awfully nice, but I can't face going into emergency at the moment.
It was just about finding balance with the patient for her to understand that she did really need to be seen in hospital just to make sure that everything was OK inside, even though she seemed outwardly quite alert and stable. On that note, I think, would you be OK if we were to phone and have a conversation with the doctor just to see what they think?
Absolutely.
Yeah?
Is there anything I can do for you while we're making these calls?
I'll tell you what, you go in the kitchen and make me a cup of tea.
I'll do that for you.
Absolutely not a problem.
If I can persuade someone to go to hospital just by making them a cup of tea, then I'll do it. So we are going to struggle if she's not consenting to come. Amy's right in having concerns about the amount of tablets that she has taken. She will need to get bloods. And again, she's absolutely right about the situation within the emergency department. She's probably going to wait several hours. She might not be seen. We'll try and see what we can do.
There can be significant delays outside the emergency department.
I don't know how it can be fixed. I think if someone came up with that answer, it would be a miracle. I actually don't know. Don't know how you would fix the NHS at the moment. The main danger would be we don't know how much she's taken or in fact what she has taken. So there's a risk that if it does what it says and makes her go to sleep, a lot of drugs, whether prescribed or not, if you do overdose on them, tend to cause cardiac arrhythmias, which is just a fancy way of saying, you know, your heart rate or rhythm will change, and some of them can be fatal, and that is a concern. She is at risk. So we'll do what we can for her.
Oh, the Borders roads are so windy, aren't they? Yeah, so they're not the fastest of roads, just because of all the twists and turns. So the Borders goes from Eyemouth way over to Hoyk, up to Peebles. It's quite a large area. It has its own kind of demands and, you know, differences to like city work. It's a very rural area. And the difference there being, because we're so far away from the cities, our backups, they're coming from further afield. So with that comes a little bit more responsibility, a bit more demanding at times, but I quite like that challenge.
$3750, go ahead, over.
3750, you've been dispatched this red call for the 30-year-old male has been found unresponsive.
When the police call for you, you know you're going to something serious. Going to calls like that, there's always a little bit of anticipation, I think, going to them. I don't think that ever leaves you.
Yeah, that's all received, thanks.
So we've been directed to Hoyk Police Station. This is a red call, so immediately life-threatening. They're suspecting an opiate overdose. They have found this patient unresponsive.
The paramedics are less than 10 minutes from the police station.
So a lot of the time, if someone's taken opiates, it can, you know, reduce their respiratory rate, so it can really affect their breathing. It slows everything down.
As well as thinking about the safety of the patient, the crew also need to consider their own.
I might get one of the police officers to stay at the back with me if he is still unresponsive.
If the patient is suffering from an overdose, then Laura will administer naloxone, a medicine that can reverse the effects of an opioid overdose.
Often, if they do rouse after giving naloxone, they'll be quite disappointed that you've given naloxone, you know, so you've got to be aware of that.
Cameroon's right aggressive.
Yeah, they can, because they've spent money on this high, and you're just coming in, you're completely taking that away. There are definitely dangers with the job. So if we reverse the effects of the opiate too quickly, they can regain full consciousness very quickly, and then it puts us at risk. It can result in, violence, aggression. We have to have our wits about us at every single job.
It's important for the crew to get the patient into the ambulance as quickly as possible to properly assess his condition.
His breathing rate was quite shallow and quite slow as well. He had pinpoint pupils, which is
major indication to us, yeah.
Huge indication that he had taken some form of opiate. Wake up for me.
If the crew can't get the patient's breathing back to normal, their condition could very quickly deteriorate.
Right, can you set up some high flow oxygen? I'm going to try and get an NPA in because he's snoring a bit now. So right now, just because his airway is slightly compromised with that gurgling that we can hear, we're just going to get some on, OK? My priority when we got him in the ambulance was his airway and breathing. With the snoring, I have to make sure that he's got a patent airway. Okay. He could go into respiratory arrest. It is life-threatening, so we did attempt just to try and open up that airway.
All right, buddy. Just giving you some oxygen. Okay. You're all right, you're in an ambulance. Just relax. I don't think he's tolerating that. We'll just take that out, that's fine. So he's starting to come round now. You're all right, you're in an ambulance. Can you open your eyes for me? Can you open your eyes for me? He's not, see the gurgling that we heard before when he was lying down, that snoring, that means his airway's at risk, so. All right. So we're just making sure he's being monitored fully for the journey in, okay? We don't know how much he's taken or what he's taken, but our only option is just to keep reassessing him. So he needs quick thinking, quick acting, and a quick kind of conveyance to hospital to get the correct treatment.
Just got to put these wee leads on you. You're all right.
Laura and Mel managed to stabilise the patient, but the hospital is put on standby.
You're all right. You're in an ambulance. You're okay. Standby is when we want to get them in quickly, when they can't really afford to be staying outside, because he is still not GCS 15, which is of full consciousness. He's still at risk of declining again back into that GCS state. So we will monitor en route, but we will get him in quite quickly, just to make sure he's getting in and getting the treatment that he may need.
Obviously, the police officer have gave him some nasal naloxone, and we've gave him 2 doses, and he's still quite out of it, so. It can be quite upsetting just seeing some of these really young people that they haven't really lived their lives yet, and this is the life that they're choosing.
Are we good to go?
Just a sec.
Because I've got a daughter who's in her 20s, it just made me think that that could quite easily be my daughter. Thankfully, it wasn't. But I just get quite upset because they're just starting their young lives, and you think if that's the path that they've chosen now, it could quite easily lead on to worse. Just makes you think.
That's pretty urgent. There's no responding as well as what we hope.
After 20 minutes of speeding through the countryside under blue lights, the crew finally arrives at Borders General Hospital.
Yeah, feeling a bit better?
The paramedics' quick intervention may have saved the patient's life. He'll now be taken into A&E to receive further care.
If we hadn't got there and if he hadn't received, 1,200 micrograms of naloxone, he could have quite easily gone into
further respiratory depression, so he could have ultimately gone into cardiac arrest. So it's really lucky for him that we got there and was able to give that treatment. Definitely, life-saving treatment there.
At the end of the day, he's a young lad. He's maybe made a few mistakes. So the reason why he's in the police cells isn't of my concern at that point. You know, his life is my concern and my priority.
Going to these jobs are becoming more and more common. Just about every other job that a crew goes to, they're dealing with some form of overdose. Whether that being prescription drugs or street drugs. And it's just a shame that we go on out there and we try and do as much as we can for them, but then they're away doing it again. What can you do?
So we've discussed a trip to the hospital with Angela. However, she is not too keen on this.
Okay, yeah, I think just it's such a big dose and her blood pressure's low. I think she needs to go to ED for a check over. If she doesn't want to go, obviously we can't make Angela go.
That's absolutely fine. Thank you so much.
While Amy tries to persuade Angela to go to the hospital, the rest of the crew turn their attention to a large mystery box in the living room.
What's in the box in the living room that you can't get out?
It's a couch.
So I've already said we'll take it out. Well, me and Wendy will manage to get it out.
Well, please have a go.
Oh.
The fact that the big box was lying in the middle of the living room was a trip hazard for her. She kind of said, that she'd been unable to make it up. So me and Wendy were like, we can do that. Strong, independent women, we can do flat pack furniture. Right, you ready?
Yeah.
1, 2, 3. Ah, it's nice. Right, so, no, it slides. Just little things. If we can make their life a little bit easier on that day, then we will.
Angela, you'll be pleased to know your sofa is erected. It looks pretty amazing.
This is definitely a first.
With her washing up done, pot of tea made and a new sofa assembled, it's decision time for Angela.
Blackmail, this is.
I like Amy's thoughts, though.
All right, then, I agree.
Hey.
It does make you happy when you know that you and the patient together have come to the right conclusion, and instead of kind of forcing, which is not what we do, we always want to work together, so it is really rewarding. So the doctor doesn't think that the emergency department looks too bad at the moment. So I can't promise you we won't wait for a while, but I am going to go with high hopes and think that we won't have to wait.
Okay, I have to think here a bit of things I might need for an overnight.
We'll help you get all that sorted.
There you go, my lady. Now, and you'll get to see your new green couch.
Yeah. Oh, hey, you see that? It's
It is really nice.
The little things, like the mundane tasks, like sometimes we put on a load of washing, sometimes we can hoover floors if that's what's needed. It just helps them out that little bit.
Look at that. Perfect. Right.
Is that us good to go?
Yes.
With Angela now comfortable in the back of the ambulance, they'll make the 15-mile journey to Aberdeen Royal Infirmary.
There's a bed for you.
What we'll do is get you inside, and then I'll bring in your paperwork, and we can do it then.
Aren't they good to me?
Yeah.
With Angela safely handed over to the emergency department, she'll undergo tests to discover whether the pills from the internet have done any damage.
She will probably be monitored for a couple of hours. get some bloods done, hopefully some more support put in place for her home life, but hopefully she'll be able to get herself sorted so she doesn't have to keep buying online.
I am so happy when you can get on with your patient well and come to the best outcomes. And I understood her reasons for not wanting to go to hospital, so the most important thing that I could have done was to help her understand that hospital was the best place to be.
I don't even remember them getting me out, and apparently I was talking, but I have no recollection of that. The whole point of the exercising going under the floor was to just check the pipeline out to see that there was no leaks or anything like that. I have to open up the hatch in the hall there and go down, and I've got my extension lead down so it gave me a good light. And that was it. I remember nothing. I can't even recall crawling around or anything like that. I haven't really got any sort of answers why I should have flaked out. And apart from that, why it should have been for such a long time. I was in hospital 3 days. All I really came out with, really, was the pressure sores, because there's rubble down there, because I was lying just in one place all the time. I suppose with most people, if you want a job doing in your house, you do it yourself if you can. I pay now. I've stopped doing stuff now.